Hello everyone. In this video we'll discuss about causes, treatment, and complications of humeral fractures. The humerus is the long bone in the upper arm. It's located between the elbow joint and the shoulder. At the elbow it connects primarily to the ulna. At the shoulder, the humerus connects to the frame of the body via the glenoid fossa of the scapula. Humerus is one of the strongest bones in our body, but it can be damaged in extreme conditions. Humeral fractures make up 4 to 5% of all fractures. The main cause of fracture in healthy people is direct hit on the bone or fall on an outstretched arm. However, in older people, the main causes of humerus fracture are cancer or osteoporosis. Rarely, the fracture is caused by extreme twist of upper arm or extreme contraction of upper arm muscles. Symptoms of humeral fracture are pain, swelling, tenderness and bruising in upper arm, limited motion in upper arm and shoulder, deformity of injured arm. In more serious cases, shortening of the arm compared to uninjured arm, and in worst cases, parts of fractured bone visible through skin, also known as open fracture. While diagnosing a patient, doctor will look at the symptoms above, and to make conclusion about exact location of trauma and severity of it, he will ask for an X-ray, and in difficult cases, CT scan may be needed. The vast majority of humerus fractures are treated without surgery. The arm can heal after it's immobilized in a cast, a special splint, or a functional brace. Surgery may be needed for a more severe fracture or any open fracture with exposed bone. The humerus will be repaired with plates and screws or a metal rod. Once fractured humerus starts to heal, physical therapy will be needed. It will help to restore normal strength in upper arm muscles. It also restores normal range of motion in elbow and shoulder. A course of physical therapy for a fractured humerus usually takes several months. For most fractures of the humerus, the outlook is excellent, especially in people aged 35 and younger. After proper treatment and rehabilitation, most patients regain full strength and range of motion in the injured arm. Generally, recovery takes at least 1 year, but union is expected at 6 to 8 weeks. Complications at proximal humeral fracture may be uneven growth, osteoarthritis, stiffness, bone infection, nerve or blood vessel injury, compartment syndrome, shoulder dislocation. Humeral fractures are classified according to their anatomical location, whether it's proximal, middle, or distal third. Its fracture pattern, spiral, short, oblique, transverse, or comminuted. Degree of displacement. Presence of soft tissue damage. One of the most common humeral fractures are proximal humeral fracture, humeral shaft fracture, and distal humeral fracture.